After you watch this video, you are going to be diagnosing some patients and trying to figure out what is wrong with them. They are all going to have disorders related to the circulatory system or the respiratory system. Some of them I'll go over in this lecture. The others, just think back maybe to other lectures we've had, and also use your textbook as a resource. So atherosclerosis is a very common type of heart disease, and heart disease, by the way, is the #1 killer of adults in the United States, so it's a very serious thing. In atherosclerosis, what happens is plaque actually builds up on artery walls, and plaque is sort of a fatty substance but turns hard. So you can see right here, this is the plaque. It causes arteries to stiffen, and it also restricts blood flow to the heart. If we look at a healthy artery, you can see how big that opening is, and then check out this artery where there's a lot of plaque buildup. There's much less space there for blood to flow through. That can cause a lot of pain, especially chest pain, which is called angina. If the blood flow gets completely blocked off, the muscle, the heart, doesn't actually get blood to it. It's not getting oxygenated blood, and so the tissue starts to die. That's what happens during a heart attack. So the blood flow to the heart is completely blocked. It's going to be painful in a lot of cases, but can also cause the heart to beat irregularly or stop beating at all. A stroke is similar to a heart attack. So in a stroke, the blood supply to the brain is interrupted. Remember, for a heart attack, the blood supply to the heart tissue itself is interrupted. So you can kind of think of a stroke as a brain attack. What can happen is a blood clot can get lodged into one of the blood vessels in the brain, and that blocks off the rest of the tissue where that blood was going from getting that oxygenated blood. Now, the blood clot could have originated here, but oftentimes what happens is that clot originates somewhere else in the body, perhaps, in an artery. It could be in the heart, and then it moves throughout the body and gets lodged there in the brain. What can also happen is a blood vessel can break, and then basically the blood is coming out of the blood vessel. It's oozing between all the tissues here, but it's not staying in the vessel, so it's not circulating. So that's going to cause brain tissue to be damaged, to die. Depending on where in the brain it is, it can have different symptoms. So if you have a stroke that's affecting the areas of the brain that control speech, that person might not be able to speak very well anymore. It could, affect the parts controlling vision, or the right side of the body, or right side of the face. So it really depends where that stroke is and how big the region of the brain that's affected is and how severe it is. High blood pressure is a serious condition because it can be a symptom of a lot of other things. So we also call it hypertension, and somebody's considered to have hypertension when their blood pressure is at least 140 over 90. Now, one thing with high blood pressure is a person doesn't have any symptoms. So unless they actually get their blood pressure checked, they probably won't know that they have high blood pressure. This is a problem, though, because if the blood is pushing against the blood vessel walls extra hard, that can actually cause little tears in the blood vessel walls that can cause plaque to build up in those areas. And it can cause the artery walls to stiffen, and that leads to atherosclerosis. Now, atherosclerosis can also lead to high blood pressure. So remember, if we do have these areas of plaque building against the artery walls, that means there's less space there for the blood to flow through. So the blood's actually going to be flowing through at higher pressure. The heart has to work a little bit harder to push that blood through those narrow spaces. So it increases the risk of a heart attack or stroke when somebody has high blood pressure. So smoking can also be related to circulatory system disease. Of course, it is more closely related to respiratory system disease. So we'll kind of talk about them together. And one thing that smoking does is paralyze the cilia in the respiratory tract. You have cilia lining your trachea, your bronchi and bronchioles. What those cilia do is help get mucus and dirt and other things that you breathe in into your lungs. It helps push them back up and out. So it actually pushes that material towards your mouth, and then you can swallow it and get rid of it through your digestive tract. So when the cilia is paralyzed, you can't get junk out of your respiratory tract. And when you're smoking, you have excess junk, tar, smoke, little particulates that get into your lungs, and you're not able to get that out very well. The smoke impairs white blood cells, and white blood cells are helping you fight infections. So you're more likely to get infections in your respiratory tract. Now, what can happen without those cilia working really well, you might get inflammation. Also, maybe you have an infection causing inflammation, but you have excess mucus in your respiratory tract that can build up, and to get it out, because the cilia aren't working, you cough. So smokers oftentimes have what's called a smoker's cough, which is really just chronic bronchitis, or can be a symptom of chronic bronchitis, where there's a constant sort of infection in the bronchi. Other problems, carcinogens in the smoke can increase a person's risk of lung cancer. It also increases the risk of lung cancer for people around those smokers. So secondhand smoke also has many of these effects on people. Smoking is also linked to atherosclerosis. So by smoking, you increase your chance of developing atherosclerosis, which then increases your chances of heart disease. There are a lot of other problems associated with smoking. So some of those are kind of listed on this diagram. So you can see types of cancers that are promoted by smoking, and then other areas of the body or types of diseases that are promoted by cancer as well. That doesn't mean you're necessarily going to get these, but your risk of getting these diseases increases. It also affects your skin, your voice, your smell. So it's just really, really not a good thing to even ever try out. Now, one treatment for heart disease, some things can be treated just by lifestyle choices. You guys researched cholesterol the other day. So by changing your diet, exercising, you can affect your cholesterol levels, increase your HDL, and decrease your LDL. There are medications that do that as well, that can help with cholesterol. There are medications that can help reduce high blood pressure when lifestyle changes don't help. There are also surgeries. So one type of surgery to help with atherosclerosis, when we have the sort of closing or narrowing of the arteries that are supplying the heart with oxygenated blood, is angioplasty. So angioplasty actually widens those obstructed arteries of the heart. So there's some different methods. There's one method where a little balloon is inserted in the artery, and it's inflated here to sort of press the plaque up against the sides and open up that blood vessel. There are also little sort of like drills that can go through here and drill away some of that material. There are things called stents that can be put in, which basically after this area has been opened up, it's going to kind of brace the blood vessel and keep it open. When angioplasties aren't possible or don't work, coronary bypass surgery is possible. So a blood vessel, usually from a different part of the body, like the leg, is grafted, meaning it is removed from one part of the body, and it's going to be inserted into the heart to bypass or go around this blocked artery. So it's sort of like a detour when you're driving and a road is closed. There's a detour, so you can still get to where you're going. You're just going to take a slightly different route. Some people just have a single bypass at a time, but if you've heard of like quadruple bypass surgery, that means they're getting 4 different grafts put into their heart to supply their heart with fresh oxygenated blood. So hopefully this little introduction to cardiovascular disease helps you as you diagnose some of your own patients.